Hi everybody, Janine here, and I am a labor and delivery nurse. I am here to talk to you today about an article I wrote about pregnancy signs. There are three different categories of pregnancy signs. You have your presumptive signs, your probable signs, and your positive signs of pregnancy. Some people might think the presumptive signs are positive, but they're not. Same thing with the probable. There's only two real positive signs that you are pregnant. But I'll start with the presumptive signs. So a couple of those are a missed period. If you normally have regular periods every 28 days or so, missed period could mean you're pregnant. But it could not mean you're pregnant as well. If you have irregular periods, or if you're one day late, you're probably not pregnant, or you could be, and it's just going to take a matter of time. Women miss periods all the time due to stress or other reasons if you're just irregular. So if you missed a period, wait a week. I know it's very hard, but then test and you could have a positive result of pregnancy. But again, that doesn't stand alone to being pregnant. Nausea and vomiting. A lot of people experience this in their first trimester and sometimes think they're pregnant right away, but sometimes just think about what you ate, or could it be a flu-like symptom or a little bug that you're trying to fight. Again, this alone cannot diagnose a pregnancy. Breast tenderness. Breast changes happen during pregnancy, but usually not until later on in the pregnancy, not right away. Right away you may have breast tenderness or just feel like they're enlarging or getting fuller, and this is a normal sign of pregnancy, though you might not be paying attention because you never thought you were pregnant before, or never tried to get pregnant before. So this actually happens before your period too, so it could just be an impending period. Frequent urination. This is a presumptive sign you're pregnant because it could be, that you drink a lot of fluids and now you're peeing a lot. Or you might have an infection of the urinary tract, or UTI is what that is. So don't think that frequent urination is a positive sign of pregnancy. It's a presumptive sign. Usually you start to have a little bit of frequent urination in the beginning because of an enlarged uterus, but really in the beginning you don't have as much as truly the end of pregnancy. Probable signs of pregnancy usually means you're pregnant, but not all the time. A positive pregnancy test. This is a sign for most people, but sometimes you can have false positives. Make sure when you're taking any type of pregnancy test that you're following the directions to a T. You don't want to mess it up at all. They usually give you a couple in a pack, unless you get the dollar ones and you only got one try. But make sure you're following those directions. Make sure it's within the range that it says on the box. If you have to wait a week of a missed period, make sure you're waiting that week, because what's going to happen is it tests for a hormone called HCG, and that's excreted in, there's my cat, say hello to my cat. It's excreted in your urine when you're pregnant. So every day you're pregnant, that hormone's going to multiply. And if you're not pregnant, it's not going to multiply. So I usually tell people, if you think you're pregnant, wait a week to test. You should get a positive result. Then test a few days later to make sure it's getting darker, because if you're miscarrying, or say you are having a little bit of bleeding, that hormone's going to drop off very quickly. Another probable sign of pregnancy. Oh, back to that really fast. I just want to let you know that there are different tests to test if you're pregnant. They range from by the dollar to well over 20. So any test will do. Get the dollar store one, especially if you're trying to get pregnant and you're going to be testing every month. Save some money. Another thing too is a positive sign is if you go to the doctor and they draw your blood and they see that this HCG hormone in your blood is multiplying as well. Another probable sign is an enlarged abdomen. Obviously, if your uterus is growing, you're going to get bigger, and but this doesn't always mean it. You could just have some bloating due to menstruation or just a slight weight gain. But when you are pregnant, progesterone's the main hormone to keep the cervix closed. So if you're starting to get some bloating and you just feel like you're enlarged and you're having a lot of gas and you think you're pregnant, you might be, because progesterone's playing a good part there. Progesterone causes a lot of bloating and gas, and it's very uncomfortable, but It's a good thing because progesterone keeps your pregnancy viable. To positive signs of pregnancy, there's only two, like I said. Fetal heart sounds, and that is, the most positive sign that you're pregnant is if you're hearing a heartbeat. And the other one is movement. You're not going to have a moving human being with a heartbeat if you're not pregnant. So these signs are only going to be distinguished through your OBGYN. So with any of these signs, if you think you're pregnant, the most important thing to do is get prenatal care. So start making an appointment with your doctor, and good luck with your pregnancy. Congratulations.